Yeah.
Before we start the session, I request you all to please switch off your mics and cameras. A very good afternoon to respected dignitaries, governing body member of RAB, Director RAB Dr. Vandana Siroha ma'am, Gurujans, I welcome you all in another intellectual session of Gyan Ganga webinar series. I, Dr. Saraswati, on behalf of RAB, welcome you all for today's session. On the onset, we would also like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vaideshri Devendra Gunaji, President of GB, RAB, respected Vaideshri Rajesh Kotecha Sir, Secretary, Ministry of Ayush, respected Dr. Vandana Siroha Ma'am, Director, RAB. Today's guest speaker is Dr. Mathews, Sir, CRAV Guru, Asthi Chikitsa and Sports Injury Management, Kerala, who has joined us today for the 266th episode of this knowledge voyage. Let us begin our session by seeking the blessings of Lord Dhanvantari. Namami Dhanvantarimadidevam Jararu Hadretyunasham Dhataram Sham Vividhashadhinam. Om Dhanvantari Namaha. Now, I would like to introduce today's expert, Dr. Mathews Vempilly, Sir, who is going to throw light on the topic Management of Sports Injuries and Rehabilitation. Dr. Mathews, Sir, is a renowned Ayurvedic orthopedic specialist, sports and exercise medicine expert, and a fifth-generation marma practitioner. A BMS graduate from BPSV Ayurveda College, Kottakkal, and MD in Shalya Tantra from Government Ayurveda College, Thiruvananthapuram. He founded Vempilly Ayurveda Hospital, Nagapura. With over 3 decades of clinical, academic, and government service, he has significantly advanced marma Chikitsa, Agni Karma, and sports injury management. Dr. Vempilly has trained numerous physicians, presented scientific papers nationally, contributed to CCRAS research projects, and received prestigious awards, including the Bishop Pratibha Award, for his outstanding contributions to Ayurveda. Now, I would like to invite Sir to proceed with the lecture. Over to you, Sir.
We had a network problem here. Sorry for the trouble. And once again, thank you for inviting me to. Is it audible, madam?
Yes, sir, it is audible. If network is not okay, then you can switch off your camera and just turn on the mic. It's okay.
Is it coming? Audible?
Audible, sir.
Audible, okay. So can I start, madam?
You can start, sir.
It's not coming. Coming.
Can you see the slides?
No, sir, slides are not visible now.
Is it visible?
Yes, sir. Yes, sir. Now it's visible.
Okay.
Can I start, madam?
Yes, sir.
Yeah. Is it audible, madam? Rightly? Okay.
Yes, sir. It is audible, sir.
Yeah. So respected officials of CRAV, I'm starting as I have a lot of time spoiled because of the network connectivity. Let me start. So my subject is sports Ayurveda, and let me pass on to the next slide. And pranam to my guru, and even he is the guru of all the CRAV gurus, Asthi Marma here from Kerala. Respected GS Raju sir, pranam to him. And this is so last week had a Commonwealth game, and 2 or 3 Commonwealth back in 2010. This was the occasion when I had an opportunity to join to have an experience with the sports persons. I was a medical officer marma practicing in one of the district Ayurveda hospitals of Kerala. And during that period, one athlete, he was training in the high altitude training center of Kerala, and he had an injury of his tendocalcaneum. And while practicing, he was not able to continue the practice, and very few days were left for the next Commonwealth game in 2011. He was Sajid Joseph preparing for 800 meters hurdle during the 2011 Commonwealth Games. And he came to my hospital in 2010. And the thing is, the next, this was his target. So he has to manage the pain. He was in terrible pain, and he was in a very good form since last 6 months, and he was a national champion at that time. And only 5 days are left for the next coming Commonwealth Games during 2011. And before finishing his treatment, he has to do the rehabilitation. And at that time, doping was very, very, very notorious at that time. Doping tests were very strict at that time, and there was no scope for internal medication. So this was the 5 aspects. So that was the situation presented me during the 2010 period. And I just had a notion that just remembering words of Vagbada, Snayu Sandhi Gada Vada Chikitsa, Snayu Sandhi Sira Prate Sneha Daha Upanaham. This was in my mind, and to maintain his injury managed and to have a rehabilitation before the event, I opted this Chikitsa protocol as my schedule for next 3 days. And this was done very effectively with the limited facilities at that time in my hospital. And he had a dhara of Danamla, followed by Upanaham with the specific drugs. And finally, an Agnikarma, Tusha Agnikarma was performed at his tendocalcaneum. And this was the result. The 5th day, he attended the Commonwealth game, and he came with a gold medal. And standing, he was having a high record at that time. The Commonwealth record was that at that time for him, and he broke the previous record of 800 meters, and that was a very turning point for me to look into sports injuries more. So right from that time up to 2015 time, as I was in a government service, I had privilege of treating almost 3,000 athletes. And prior to the Olympics, Mr. Srijesh, who was the hockey captain at that time, had a rehabilitation before his Olympics trial in the previous Olympics. That was my time. I had a privilege of treating almost 3,000, 4,000 athletes in the national, school level, college level, and national and international level. That was my debut to the sports, treating the sports person during that time. So this was not just an introduction why I came into this field, as even though as a marma practitioner, I had the privilege of treating almost all the very special athletes of our Mother India. So sports medicine, it's a vivid area which encompasses field like first aid and injury prevention, fitness and performance enhancement, and injury management. Sports and nutrition, kinesiology, sports psychology is also a part of sports medicine. And I was focusing only on sports injury management. These coming videos will give you the kinesiological factors involved in a sports injury. So a carpal tunnel syndrome is mostly seen in almost all the racket players. So the factor which gives you tremendous repeated stress on the wrist as well as elbow which gives you the nutshell of what is the kinesiological factors involved in this game. The tennis as well as the table tennis, right? The lateral epicondyle, we call it as tennis elbow. See a batsman batting and how his forearm muscles are involved. The extensors of the muscles, extensor muscles, which gives you pressure on the lateral epicondyle, which creates a repeated stress on the epicondyle, which is responsible for the epicondylitis, or which we call tennis elbow. And also all the racket sports are all creating pressure on the shoulder and elbow. This gives you a kinesiological explanation why these people are prone for elbow and wrist injuries. And this is another golf which creates pressure on the medial epicondyle. You can see the how a person is doing when doing golf, how his medial epicondyle is being injured repeatedly. And next one is medial epicondylitis. Another in archery games and weightlifting programs also there is chance for repeated stress to the elbow. You can see how the those men who is putting the shot put, how his kinesiological activities, the muscles of the upper limb is being given under tremendous pressure. And also in archery also it is the very same thing. And also in weightlifting also the same thing happens.
Is the slide moving?
No.
Yes, sir, your slides are visible. Now it's not visible, sir.
See, nowadays the most prominent injuries among the athletes and sports persons are shoulder injuries. Here, this is an explanation how rotator cuff is being injured. Rotator cuff is being given so much stress while badminton, all the basketball and also the cricket also giving a lot of injury to the shoulder, which gives you rotator cuff injuries are very prevalent in sports persons. And cycling in and hurdlers are more prone for iliotibial band syndrome and hip injuries and a lot of other type of bursitis around the hip. So this is the mechanism of how a person is if going for such type of athletic activity, getting preference for developing hip injuries, knee injuries, and calf injuries. And next one is patellotendinitis, jumpers, jumping sport item, volleyball, basketball, and also the hurdling. All this gives tremendous pressure to the knee, which gives you a lot of injury to the knee as well as calf and ankle. So that's why that term is called jumper's knee. So that type of athletic activity is prone for developing more injuries to the knee and lower limbs. And shin splints are very common in footballers and tennis players, which gives you a rotation of the knee while extension. Rotation followed by knee severe extension. So that is very prominent mechanism which gives you shin splints. And next one is retrocalcaneal area injuries. Calcaneum and ankle injuries are very, very common in retro and walkers and slow long rise. In long rise and also walkers, these type of injuries are very, very commonly seen. And finally, and marching as a part of walking, as a marching, there can be injury to the foot, which creates pressure on the metatarsals, which gives you Mars fracture. That's why the term itself is called the Mars fracture, fracture of the second metatarsal. So these are all some videos which shows you how sports person are prone for injuries, injury prone to the injuries in different sector, right in the upper limb, lower limb, as well as spine. Can I move? So as a part of general orthopedic conditions, you will get in two headings. One is
Sorry
sport
for the
condition.
interruption, sir. Sir, your slides are not visible.
Okay, so I switch over to the switch over from the video that creates a lot of trouble. So general approach in orthopedic conditions, we have two sets of conditions. The cold orthopedic condition, which we call non-traumatic or chronic type of orthopedic conditions, and the hot orthopedic conditions, which we call it as a trauma and or acute type of orthopedic conditions. Generally speaking, the diagnostic features includes the clinical examination, the radiological factors, the lab investigations, and in some selected cases, advanced techniques, advanced immunological techniques are also very, very essential in diagnosing certain the orthopedic conditions of sports injuries. Line of management. Basically, there are two types. As you all know, there is conservative management as well as surgical management. Generally speaking, the traumatic conditions includes fractures, different types, dislocations, and sprains, generally speaking. And the traumatic conditions, you can divide the conditions as direct trauma, just like this, as I have shown in the slide. Next one is the indirect traumas. A footballer, when falls down, creating injury to the knee. It's an example of indirect traumatic conditions. And finally, repeated strain injuries, which is very, very common. From the videos also, you have seen that repeated stress is the basic cause for almost all the soft tissue injuries to the sports persons, especially the tendon, fascia, muscle, bursa, all those things. So this is very, very important in almost all the sports persons. So repeated strain injuries, if you are going into the details of the what the definition refers to the damage and pain caused by repeated movements or overuse. It affects muscles, nerves, ligaments, and tendons, common in sports, particularly affecting the sports persons. So right from, if you are taking the structure right from the skin to bone, there can be blisters, stress fractures, bursitis, tears or muscle hernia, tendinitis, rupture or enthesopathy, strain and instability in ligament, and finally synovitis in joint. So these are the factors involved, basic structures which are involved, and the basic whatever the presentations are like that one only. So concept of fascia is also important when you treat a sports injury. The fascial system is a complex network of connective tissue that interconnects all the components of the musculoskeletal system. The normal fascial system is selectively inconspicuous in MRI. That's very important. So even if you are taking an advanced investigation, you will not be able to see the facial injuries or facial involvement in a particular injury. So you have to selectively go for the particular clinical examination and differential diagnostic points only. Then only you will get the any injury, any factors involved in the fascia will be presenting. MR patterns of facial involvement in autoimmune disease reflects the complex anatomy of the musculoskeletal facial system. So factors contributing to the sports injuries are, these are the factors: too much too quickly, too heavy, inadequate warm-up, poor equipment, incorrect surface, poor technique, mechanical imbalance, previous injury, poor healing, and competitive pressures. And in other words, we can say it as fast repeated movements, excessive load, inadequate training, unsuitable tools or components, poor workplace, poor job design, poor posture or support, outside stresses, cold, calm situations like that one. Okay, basic pathology, you can take it as friction, stress, and ischemia. These are the three factors involved in basic almost all the soft tissue injuries. Friction, tendon bursa may get during the joint movement may subjected to the excessive friction within a fibrous sheath or over bony prominence. Stress and ischemia. Ischemia may be an acute ischemia or a relative ischemia. Relative ischemia is more commonly seen in sports injuries. Acute ischemic conditions are it needs very urgent care and it's a medical emergency. Diagnosis should include the diagnosis depends on the taking careful history, examination of the knowledge of the clinical applied anatomy, physiological soft tissues such joints, muscle, tendons, examples are very, very important. Lesions. So always you have to exclude the possibility of a systemic disease even though a patient even though a sports person is coming with a local lesion. So you have to rule out all these general conditions like early phase of RASLD, viral bacterial infections, generalized osteoarthritis, endocrine conditions, osteomalacia, Paget's disease, malignancy, akinetic phase of Parkinsonism, fibrositis, like that one. So you have to rule out all these things, and then only you should get an exact diagnosis, precise diagnosis. The clinical findings, as per the marma point of view, if you are taking the marma bhigada lakshanas, mamsa marma bhigada lakshana, asti marma, sira marma, snayu marma, sandhi marma. The general marma with the lakshanas are clearly mentioned in our texture, all the textbooks. And if you are looking into it, you will get a very beautiful explanation of if one and each and every one. For example, if sandhi marma is involved, for example, jani marma, intense pain, limping, reduced range of movement, reduced power, reduced muscle bulk, and joint swelling. This is a typical feature of joint injury. Any joint injury is resulting in Sandhi Marma Samani with the Lakshana. Same thing is happening here also. So the Sandhi Marma with the Samanya Lakshanas are very, very important in when you are going through a management of a Marma Vitha Lakshana, Marma Vitha condition. So Ayurvedic concept regarding the etiopathogenesis, right from Abhigadam, Abhigada Vishesham, Padana Pidanadi, Abhigada, Nidana are mentioned in Susruda, but special type of Abhigada is happening in sports person, which creates a vitiated Vada. Secondary Rekta Pitta involvement along with the Kapha is coming. Sthana Samsara at Mamsa Asthi Siras Nayu Sandhi, which creates a Marma Abhigada. So that can be a etiopathogenesis of a Marma Vitha in sports person. Treatment which includes Marma Bhigada Chikitsa, Uttana Vadarakta Chikitsa, Bhagna Chikitsa, as Snash Sandhigata Vada Chikitsa. You can take these four aspects as a treatment protocol for almost all these sports injuries, generally speaking. So Marma Bhigada Chikitsa is very, very important. Each Marma is inflicted. We will get a definite signs and symptoms, and you should treat accordingly. And in every injury, there will be a Rekta Pitta involvement also, which creates an Uttana Vada Rekta Lakshanas, which also deserves attention. And in Bhagna Chikitsa, of course, you have to follow the Bhagna Chikitsa protocol itself. Snayu Sandhigata Vada Chikitsa, Snayu Sandhigata Vada Chikitsa is clearly mentioned in Susruta and Vagbhada. You have to follow that schedule also. So, nutshell, you have to follow these four protocols when you are focusing on a sports injury. So, Marma Bhigada Chikitsa again, if you are going into detail, highly specific according to etiopathogenetic factors. From person to person, the management protocol for the Marma Bhigada Chikitsa is different. Specific Marma stimulations are very, very important. Different types of bandaging. Bandaging are very important. Kosha Sustika Mottoli, China Dama, like that one, 14 or 15 bandaging types are mentioned in Vagbhada as well as Susruta. This is very, very relevant in managing not only the sports injuries, any injury. Labors are very, very significant. In Kerala, we are using a lot of different types of labors, like which we call marma labor. Different types are there. According to the situation, we use different types of labors. Kshiradhara, Tailadhara, Piju exam are very, very important in marma Abhigada Chikitsa. When we are going through the Uttana Vadarakta Chikitsa, again, the external therapies are very, very highly significant. Leba, Abhyanga, Parishega, Avagaha are mentioned in the classical texts. And we have to follow the external therapies according to the condition, specific condition. And of course, Uttana Vadarakta, apart from the Uttana Vadarakta Chikitsa, practically speaking, Puttapaga Leba, special Marma Leba, Ushma Svedas, pressure bandaging, Jaluga Vajarana, Agnikarma also as a part of Anushastra, we are implementing that, we are incorporating that also in the management of sports injuries. And also Bhagna Chikitsa, as you all know, the basic concept is reduction, immobilization, and rehabilitation. That is to be followed in if there is a Bhagna or a fracture. So again, Snayu Sandhigata Vada Chikitsa is very, very important. So as my first slide also showed the importance of Snayu Sandhi Sira Prate Sneha Daha Upanaha, which is very, very relevant in all the sports injuries, especially in soft tissue injuries. It is very, very relevant. So this protocol is very, very useful in the management of sports injury management. And scope. So we have a lot of possibilities in managing sports injuries apart from the modern fraternity. We have different types of bandaging. So as I told you, different types, 14 types of bandages are mentioned. Each one is indicated in each condition, which is specifically very clinically useful and is being used in Marma Chikitsa. And nowadays, a lot of orthos is also, which is very user friendly and patient friendly, and which also can be utilized along with the bandages. And marma points, stimulation of marma points, watching the marma energy and revitalizing the marma points are also getting very good scope for sports Ayurveda treatment. Anushastras are also very, very important. So, but this is our very powerful tool in managing the soft tissue conditions. And rehab, of course, any injury, especially for sports person, any injury, after the injury, we have to go for a rehabilitation. We have a very good protocol for rehabilitation. Our Sneha Sweda and different types of Swedas, Snehas, and those things are very, very helpful in managing the sports person and giving a beautiful rehabilitation before the event. And importance of differential diagnosis. So just for the students, I'm telling you, if you are going through a shoulder injury, it can be a rotator cuff lesion. It can be an instability. It can be an orthopedic neurology like a preferred vein from the cervical spine. Or it can be a soft tissue injuries, a bursitis, a tendinitis, or like that one. So especially in sports injuries, we have to have the very definite diagnosis. Which structure is being involved is very, very important. Then only we can plan the treatment and we can focus on the rehabilitation accordingly. So just for the shoulder itself, these are the possibilities, generally speaking. So for example, case one, for example, a 55-year-old male is coming after a fall on outstretched hand. So the most possible diagnosis will be an acute supraspinatus partial or full tear. Okay. Next one is another person fall on outstretched hand and coming unable to attempt any movement. This can be a case of shoulder joint dislocation. Another person, the same fall on outstretched hand, 62-year-old female. That is very, very important. In above the 50 age of female, there is most possible chance of postmenopausal osteoporosis. So if the patient is not unable to do an abduction after a fall, the chance is for fracture greater tuberosity. So just a fall on the same mechanism, the presentation will be different according to the age, sex, everything will be the diagnosis is very, very important. You have to go through the history and very definitely examine the patient carefully. For this is a usual nowadays among the shoulder injuries, supraspinatus tear is a very, very commonly seen in athletes. So we have formed a definite protocol for managing the supraspinatus tear. It can be the grade of supraspinatus tear can be graded as grade 1, grade 2, grade 3. So if it is a grade 1 tear, the protocol will be bandaging for 7 to 14 days, rehab for 7 to 14 days, better outcome will be coming in 28 days. If it is a grade 2 supraspinatus tear, you have to immobilize little more, 3 weeks of immobilization and 3 weeks of rehabilitation. And if it is a grade 3, you have to confirm the diagnosis and explain to the patient, and the effective treatment will be coming only after 60 days. So this is a protocol for managing the supraspinatus tear. General protocol. General protocol for the sports injury persons. These are the general protocol. Peace and love, price, police, no harm, 3R. Peace and love, first of all. Protection, elevate. In the first phase, never give you too much anti-inflammatory modalities, compression, and educate the patient. This is very important. Peace. And again, love, load optimism. You have to grow. You have to advise the patient to load very carefully. And optimism, vascularization of that injured part is very, very important. So protect that area for a period which you decide. And exercises is most important in all the sports persons to get a more efficient rehab. And no harm, heat, alcohol, re-injury, massage. So everyone thinks that in Kerala, it's a normal practice that the quacks, the non-educated, they are not doctors, quacks. They are going for massage immediately after any injury. That's why this message is very important. Never go for massage to any acute injuries. So prevent no alcohol, no heat in the initial phase. Re-injury is a very, very risky factor. And again, definitive management of bony lesions are reduction, retention, and rehabilitation. And rehab, as far as sports person, even though if you are treating the injury well, the rehab is very, very important. So for the rehab, we have more options than the modern medical fraternity. We have Upanaha, different types of labors, Sega, Thara with Dhanyamla, Kashaya, Kshiradhara, Tailadhara. All these can be provided according to the condition of the patient. Vyayama and active exercises are very, very important in rehab. And our classical description how rehab is being given an explanation in our text. The Vagbada says that Mritpundam dharet purvam chatata param haste jadavale jabi kuryat pashana dharanam. Mritpunda dharana means in the initial phase active use and exercise. In that phase we can do Upanaha. The next phase dhara with the different modalities which I have mentioned earlier, right from Dhanyamla to Tailam. And Vyayama, Aste Jadavale Chabi Kuryat Pashana Dharanam. It indicates the active use and exercise with the weight bearing. Weight bearing exercise also mentioned in our Samhitas. So this is very, very important. Parishekam cha pradeham. This stanza gives you a very good explanation. The acute phase, we have to go for Shidopachara. We never opt for Ushnopacharam in the initial phase of any injury. Just like as in sports injury also, the modern fraternity also stress the importance of cold therapy in the initial phase. So Acharya also is significantly saying the importance of Shidhopacharas. And next one is Vishlishta Deham Padidam Madidam Hadam Evacha. This gives you an importance of Marmahada. Just as Sadhyavrana, some protocols for Marmahadam also. Just as the protocol for Sadhyavrana, we have to follow any marma injury, we have to follow like the Sadhyavrana. Next one is we are giving the importance of Sadhyavrana, just like Sadhyavrana. In the initial phase, we have to go for Sidopachara and then only Paschat Purva Majaret. Saptaham, Sadhyavrana, Saptaham, Paschat Purva Majaret, Purvakta Majaret. The same protocol is being mentioned in our Acharyas also. Next one is Vishishta Charaka Siddhisthana, giving you an importance of Vasti in Charaga Siddhi. We are getting an reference regarding the importance of Vasti in Marma Paripalanam. Even though the Marma stimulation gives you Rucha, the Vasti gives you a Snigdha. So here Vasti means a Sneha Vasti itself. So again, Pittarekta Abhigada Vigaras, we have to go for Parishegan, Anushna Shidam, Upayogam. That is the significance of Pittarekta involvement is also there in the later phase of the injuries. So we have to go for Anushna Shidam, Parishegan Kurvita. And this is very potential Falasruti of Gandha Thaila, which is being mentioned in Ashtanga Hridaya and Susruta also. Gandha Thaila is being widely practiced in Marma Chikitsa, and here in sports injuries also in the secondary phase, the first phase when the Amavastha is over, we also opt for internal application of Gandha Thaila. The importance of Gandha Thaila is very well mentioned in the text. And acute injury management, these are the formulations which we generally use in a clinic when the OPD level. Punarnavadi, Laksha Gugulu, Mustadi Marma Kashaya, which is being taken from the pharmacopy of Trivandrum Ayurveda College. And phase 2, Dhanvantaram Kashayam, Kaishora Gulgulu is being given internally. And phase 3, Dhanvantaram Thailam, Gandha Thailam. When the Amavastha is over, Gandha Thaila internally and externally is being given. And Gandha Thaila, phase 4, Rasayana Chikitsa is coming, and Gandha Thaila, Ashwagandha, Triphala Amalagi are mentioned. So, if you are going for the external application, in the first phase, Muruganna, Nagaradi Lebam. Nagaradi is also taken, is also mentioned in the Trivandrum Ayurveda College pharmacopy. It is taken from that area. It's a combination of 6 or 8 ingredients. Nagaradi Leba Churna, which is given for traumatic situations for preparing the lepas in initial phase. The secondary phase, Amlarasa Pradhana Thaila, like Chinjadi Thaila, Kotanjukadi Thaila, like that, Amlarasa Pradhana Thaila is being used in the second phase of as an external application. And finally, if the patient is going for inpatient management, Snehavasti, Leba, Upanaha, Sega, Avagaha are being used in sports injuries. And as Rasayana, Tila, Gandhadaila, Ashwagandha, Kaishora Gugulu, Tila, Amalagi, Tila, Triphala Churna are also mentioned in the textbook, and we are following the same protocol in the IPD also. And Tristona in the management, Pathya is very, very important. Medicines are equally important, accurate medicine, and Vyayama is also indicated. Tristona to avoid recurrence, Vyayama, Rasayana, and internal Sneha. So, after the rehabilitation phase, we recommend specific exercise to maintain the core strength, to get a more strength of the muscles, to get a more good performance. And we recommend specific Vyayama is very, very important. The exercises as being given in very scheduled form, giving a very progressive manner. We recommend exercise also. And Rasayana drugs are very, very important. Internal Sneha like Indagandha Gridam, Rasna Desamula Gridam, Gandha Thailam. These are all very, very importantly used internal Snehas. Post-traumatic stiffness, here we go for Upanaha with Leva, Nagradi, Dhara with Dhanyamla, Kashaya, Shira, Thaila, Matravasti with Dhanvantaram Thaila, post-traumatic stiffness. And IP level, Sadyovana, Sadyo Virejna, Snehavana, Niruhavasti, Yavanavasti. Yavanavastis are very highly useful in managing acute conditions. As after the acute condition, we used to give in IP level, Yavanavastis are being very well utilized. And Anushastras, this is a major tool, especially it's a very superior tool which can be used in almost all the marma vijada in different stages according to the stage. Agnikarma, Snigdhagnikarma, Rukshagnikarma is also being used. Raktamoksha, Siraveda, Sringa, Jaluga. Apart from that one, nowadays Vithakarma is also being practiced widely by marma practitioners to facilitate the myofascial release, to relieve the myofascial pain syndrome, to get an acute pain management also. So this is very, very important. It's importance of Asra Visruti, which is mentioned. When the Snigdha, Ruksha, all these prayogas are not getting benefit, you have to go for, when we feel that the disease is as a result of Rakta Gopam, then go for Asra Visruti. Any Rakta Moksha procedure can be maintained. Yeah. Snavasandhi Sira Prapte Snehadaha Upanaham. Is very, very important. In sports injuries also, some of them can be very mentioned. This is seen only in Kerala. Traditionally used a herb which we call it as Pavata, Lekhu Pavata and Brahat Pavata, which is having a very anti-inflammatory activity. And as you all know, in all over India, it is being used. Cissus quadrangularis. And next one is Heptega bengalensis. It's not having a Sanskrit official, very convincing Sanskrit Sanskrit name for this one. I have searched it, not particular name in Sanskrit. It is being used in the traditional Vaidyas of Middle Kerala, Nyarambodal, which is being used in the ligament injuries, tendinitis, such type of soft tissue injuries. We used to give this drug as external application. And this is another form of Karaskaram, which is a climbing type, which is being used as an anti-inflammatory agent, which is being used as to decoction for avagaham and also for external application as preparation of dhara, pain-free management to maintain the soft tissue injuries. We used to make decoction with this one and give dhara. And this is an ingredient of Muruvenna, which is a very traditionally used in Kerala, in Marma Chikitsa. This is an ingredient of Muruvenna itself. Another one is ingredient of Mustadi Marma Kashayam, which is given externally in Marma Chikitsa. And this one is also very traditionally used drug in Kerala for the management of Marma Bhigada. And you all know that this is a very used for making potalies to prepare marma potali. It's an ingredient of marma kiri, like that too. And as you all know, Sesamum indicum. It is widely used in sports injuries, and the rehabilitation phase we used to give is as candies along with the jaggery. Sesame is being given, which gives you a very good result for the sports persons. And Laksha, of course, is given as Laksha Shiram as well as Laksha Gugulu, which is very effective in the management of traumatic conditions. While managing the orthopedic conditions, so you should have an adjustable table. It is very, very important. So while giving a manipulation, while giving a bandage or anything else, an adjustable table is good. And for the Droni also, if you have an adjustmental, what you call height adjustable stand, that will be very effective for the management of any orthopedic condition. Yeah. And a minor OT is very, very important as we are offering Anushastras, Agnikarma, Jaloga, Ujarana, Vyasra Visudhi, everything should be done in a mini OT. And importance of yoga. So almost all the sports persons, while after they getting injury recovered, we used to instruct specific yogasanas for as a part of giving rasayanas, and at the end of the treatment, we used to recommend each sports person to go for specific yoga therapy also. And along with our classical Ayurvedic treatment, in our hospital, we used to integrate all our treatment with the modern physiotherapy schedule also. These are the things which are involved in manual therapy. Apart from the electric therapies, manual therapies are significantly very useful in the management of sports injuries. So traction system we are using, and this is a very beautiful explanation how Dhanyamala is prepared and well kept, and it is a very powerful tool for providing the initial phase of the inflammatory phase of any injury. Dhanyamala. Yeah, this is very, very important. We have strengths like effective pain relief, marma therapy, acupressure, kalari, chikitsa are very, very, very prominent in Kerala, which we are using. Tissue healing is minimal with the potential drug interaction, with the specific drugs internal. Excuse me. Parasurgical intervention, Shara, Agni, Rektamoksha, like these are all our additional tools. Rehabilitation supports. Sneha Sedas are very, very effective in the management of sports injury conditions. After the injury management, rehabilitation, Sneha Sedas are very prominently we are using. And weakness, we have weakness in the complex traumatic situations like open fractures, limited. These are all our weakness points. And finally, the opportunities are management of musculoskeletal injuries are these are the very powerful areas of marma chikitsa. And these are the threats to the Ayurvedic treatment, especially in Kerala. Yeah. So finally, the scope of Ayurveda and orthopedic condition and sports injuries, we have in court conditions, we have a 20% role, and modern medicine is having an 80% role. And all the called orthopedic conditions, we share the same share almost. 50% we have a role, 50% modern medicine also is running. So this is very important conclusion. Accurate structural diagnosis is essential for effective management of sports injuries. Proper clinical examination is very relevant. These are the conditions which we can confidently manage by an Ayurvedic practitioner. And complex conditions like comminuted fractures, stress fractures, RTS are beyond our purview. Logical, patient-friendly reduction, immobilization, rehabilitation techniques are usually crucial. Marma techniques, warmology, acupressure, kalari methods, benefits, management of acute pain. Ayurvedic graduates should receive basic clinical training in this field to enhance the clinical skills. That's why CRAV students, those who are coming to Kerala, they get a very good opportunity to have exposure to orthopedic conditions and also the sports injury management. So I'm grateful to all the Asthi Marma gurus of Kerala, especially my seniors. They are all doing very well practice in not only in the orthopedic conditions as well as also sports injuries also. So message to my students is that observe each and every situation which you face, learn from them, practice carefully, and develop your skill. So observe, learn, practice, and develop skill. This is very important for any juniors. So those who are the students, those who get an opportunity to see any clinical situation, they should make it a learn and practice and develop the skill according to the situation which you get. This is very important. So interact with the parallel medical schools. We should not be restricted to our own hospital only. We have to get more references. We have to give more references. So integrate concepts, evolve practice without losing fundamental principles. And you should have a very good team to offer a very good treatment, especially for sports persons. We need the support of good therapists. We need the support of good junior doctors. We need the support of good therapists. We need the support of very good yoga specialist. We need the support of very good physio also. So we have to give a very good nutrition based diet also. So we need a team also for managing a sports injury clinic. So there should be an attitude, stay humble, positive, dedicated, and committed to the continuous growth. That is very, very important. So integration of healthcare services are very, very important. And organizational integration, a service integration, and clinical integration, and a functional integration. The total integration is very, very important. As per the time, as per the present situation, we have to update everything. So nowadays, a lot of changes are being happening in the field of medical field. So we have to accept all the engineering benefits of whatever happening around us. We have to go for integrate with the whatever which is useful to our clinical practice. You have to adopt all those things. That is very, very important. So just I am showing you a Colles fracture managed in our hospital in the conventional way itself. So this was a case initially presented before treatment. Here we can see the check X-ray. Sorry. So here is the check X-ray. We are splinting. We have give the conventional way of splinting the Colles fracture and maintain for 3 to 4 weeks and giving you the rehab afterwards. So that was the thing. Sports person treated at Vempilly, I know that during the last 3 years. So we have the opportunity to treat all these persons, respected persons from different states. Tamil Nadu, we had a very good person. He was Lakshman Ray and Mukesh Yadav from Uti and Dalvinder Thoma from Haryana and Sajan Prakash, who is attending the present Commonwealth Games. He had a rehabilitation last year, and he was very good. And after the rehabilitation, he felt very well. This is our team of physio and our hospital senior staff. And these are the list of athletes which we treated here last 3 years, one by one. So all these patients had severe injuries are being mentioned. The sports category is being mentioned. Number of days we took. We used to take very minimum days for the treatment. That is also very, very important. So sports persons are not able to attend for a long period of stay here. So we are giving a treatment with an integrated level and giving very good treatment protocol in the initial phase itself, so that they can finish the treatment immediately and they can go for the rehabilitation at the earliest. So welcome to, this is our hospital and this is our team of staff, and this is my, you have to be problem oriented, and your work, you can get your experience through practice and practice. Yastu Kevala Shastrajna Karma Swabedinishtada Samvrityadram Prape Meri Rivahu. And this is very important. As a Shalya practitioner, you have to be very courageous. You have to do very definitely, you have to be very brisk. You have to do that very with the precision. Yeah. And just a case presentation. Last month, this person was from Rajasthan. He was an 800-meter athlete. He had an ankle pain and an ankle injury, and aggravated during the running, prolonged standing, past history, minor left ankle fracture. Occasional low back pain was also there. Yeah, and the clinical findings are this much. Generalized tenderness around the left ankle, painful flexion and extension, restricted ankle mobility, ankle tendon myofascial tightness, weakness of ankle stabilizers. Diagnosis was Gulfamaramakshadam. Clinical diagnosis, talocalcaneal osteoarthritis grade 2 and left Achilles tendon tendinopathy. The pain score before the treatment was 5/10. Minimal osteoarthritic changes were seen in the X-ray, and the treatment protocol was this one. The phase 1, we gave internally Mustadi Marma Kashayam, Dhanvantari Gulika Laksha Guglu. Goal was to control inflammation and promote tissue healing. The second phase, internally, magnesium was supplemented. As we see that magnesium is very, very useful in the management of soft tissue injuries, especially to get a fast recovery. The goal was tendon strengthening, neuromuscular recovery. The phase 3, we gave Benaristam and Mamsarasa in soup form was given. And the goal was tissue nourishment and improve strength and endurance. And integrated therapeutic interventions were done as per Ayurveda interventions. Dhanyamladhara, Levam, Upanaham, Viddhakarma was initially done. And physiotherapy level, myofascial release was also done. So same purpose was done. The Chinchalavana Svedam and Marmaki was a second phase, and joint mobilization and stretching was done. And finally, Shastriya Banda Svedam was given, progressive strengthening and program for ankle mobility and training. So the outcome was, at the time of a discharge, the pain score was 1/10, clinical improvements with the complete resolution of tenderness, pain-free ankle mobility, improved ankle strength, better functional performance, successful completion of rehabilitation program. A 12-day integrated rehabilitation programs combining of Ayurveda and physiotherapy resulted in a significant pain reduction, restoration of ankle mobility, improved tendon, and improved function. Thank you. Thank you very much. Thank you very much for your patience here.
Thank you so much, sir.
Thank you.
If anyone is having any doubts, they can ask now.
Hello, sir. Good evening.
Good evening.
Sir, my question is that as you describe all the procedure in sports injury, sir, it can be used in like osteoarthritis and the chronicity of the pain and the chronicity of any joint disease. Then we can use that procedure in that area.
Yeah. Same protocol according to the situation. Avasthanusridham, Kalanusridham. You can utilize all these protocols in the osteoarthritis. In the initial phase, you have to go for the first phase itself, Tucha, then go for internal medicines according to the condition of the patient. You can follow the very same protocol for chronic or osteoarthritic condition also.
Sir, the band you advise the patient are the classical bands.
Which one?
Bandages you advise to the patient, sir, that are the followed by classical bands.
I'm not getting, sir, the proper audio is not clear to me. Once again, if you...
Sir, my question is that your bandages, your band that you are advised to patient is...
Yeah.
Yes, sir. Can it is also applicable in chronicity?
So selective immobilization, if selectively it should be done. It should not be hard or very... So it depends on the condition of the patient. You can choose classical bandage. You can selectively use it according to the condition. But at the same time, if the patient is not in a position to work with this type of a bandage, you can go for latest orthosis also. Same thing. But if you are going for the bandage, the advantage is that you can put some medicine also inside.
Sir, sorry for my last question is that, sir, the maram potli you advise to patient, can can please, sir, you tell about the ingredients of potli?
So ingredients, so if you just give me, share your number, I can send you the ingredients. So many ingredients are there. A lot of 8 or 10 drugs are there. I can give it, share it.
Okay, sir. I will contact with your students in a group.
Yeah,
Okay,
yeah,
sir. Thank you.
yeah. My students are there from, you can contact them and we will give it the exact,
Thank you. Thank you.
number of ingredients as well as the, how much you have to take, all these things they will give you.
Thank you, sir. Thank you so much.
Excuse me, sir. A personal doubt.
Yeah,
Hello?
yeah.
Am I audible, sir?
Yeah,
See,
sure.
if very initial osteoarthritis, in normal walking, there is no pain. But when the side, the either lateral side or medial side, when it is a slightly movement of the joint, then there is pain, and that continues for some time. And while we are driving, especially I'm talking about the left knee joint, when we press the clutch, and then there is pain. But while walking, there's no pain. So when we press the clutch, and there's a pain. So
So
what and
so mostly, sir, from your talks, I feel that it is a case of retropatellar involvement. Retropatellar in the sense of patellofemoral OA changes will be there. Chondromalacia will be there when you are pressing too much, pressing on the patella posteriorly, which creates pain. That can be the reason. So mostly in almost all the osteoarthritic conditions, patellofemoral joints are also mostly involved. So you have to go for some Upanaha or LEPA, then that internal inflammation will be okay. And even if after recovering from the inflammatory phase, you have to advise to do specific quadriceps drill, just like some exercises for improving the extensor mechanism of the knee joint, like quadriceps drill, hamstring stretching, and internal that type of non-weight bearing exercises can also be, it should be advised to the patient to avoid recurrence.
Sir, excuse me, I am Dr. Dattatreya from Tirupati.
Yeah, good evening, sir.
Sir, how many sittings we require for a tibial injury or suppose a injury in the elbow for marma chikitsa? Marma chikitsa, pressure is the marmas. And how you will select the various marmas?
So it depends on the condition. So you mentioned about the corpora sandhi, elbow injuries.
Yeah.
So you mean a soft tissue injury or a bone injury?
In one case, it was a bone injury also. Some displacement of the joint was there.
Oh, then you have to follow the, so if it is a bone injury or involving the joint disrupted, then you have to go for the Bhagna Chikitsa protocol itself, sir. Initially, you have to go for immobilization according to the condition, then go for rehabilitation. So initially, so in the rehabilitation phase, you can use marma techniques. One or two, one sitting may not be possible, may not be sufficient. Consequently, you are in the initial phase, after the immobilization part, when you are going for the mobilization, you can use Sneha Sweda along with that one to release, to get the movement. You can, marma points are also very important. And you have to go it for consequently for 5 or 6 days.
Okay. And is the marma points are pressurized only manually or any specific device is developed by you?
No, so we are not doing, our hands are our devices, sir. Hastameva pradhanam.
Nice, sir. Thank you so much.
Thank you.
committee, I'd like to thank Dr. Mathews, sir, for delivering such an insightful lecture. I would like to extend my sincere gratitude to our mentors, Dr. Devesh Tribhunaji, President GPRAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vanta Siroha, who is the guiding force for all the events at RAV. I would also like to thank Dr. Rajesh Kotecha, sir, Secretary, Ministry of Armies, for his participation and encouragement in all our endeavors. Most importantly, I would like to express our heartfelt thanks to all the gurus, shishyas, and other scholars for the presence and active participation to make this webinar a successful one. Thank you so much, sir.
Thank you. Thank you once again. Thank you once again, all the faculties, especially the office bearers of CRAV, for patiently hearing my presentation. Thank you once again.